Hi, everyone. I think we're live. Thank you for joining us today. We're going to talk about perinatal OCD and anxiety since this is Maternal Mental Health Month and Mental Health Month in general for May. So we have 3 more days. I'm Dr. Jenny Yip, and I am the executive director of the Renewed Freedom Center. I've worked with this population, the perinatal OCD and anxiety, for actually over 2 decades now. So this topic is very, very important to me because I experienced it myself. Even though I'm supposed to be an OCD expert, I had my own battles with postpartum OCD. And I'm so glad that the International OCD Foundation is holding this live stream today for this very important topic because there's really not enough conversations about this. And what I'm hoping this will do for us today is bring about more awareness about this topic, and then hopefully decrease some of the stigma around it. So I'm happy that we have Kevin and Renee to join us today on this conversation. I'm going to let them introduce themselves. So first, Kevin, would you like to tell us and share why this is important for you to be here today?
Yes, thank you so much, Dr. Yip, for having us and hosting this conversation. I really appreciate IOCDF as well. I've turned to the resources for a long time as someone who has experienced OCD myself. And as I've talked about with Dr. Yip, I first realized that I had OCD after I had my first child 13 years ago. And I felt so lost and alone and overwhelmed. And fortunately, I was able to get a diagnosis eventually, not right away. But long story short, I found a good therapist, did ERP, had treatment, and I've been able to keep it at bay for this long. And so my postpartum OCD, I would say, in large part, along with becoming a parent, is what sort of catalyzed my work as a journalist and writer. And I cover my postpartum OCD experience in my forthcoming book, The Progressive Parent. And so, yes, I could ramble for a while, but that's what brings me to this live stream today. I'm excited to be here.
Thank you. Thank you for sharing your personal journey with everyone. I'm sure that will enlighten a lot of people, and hopefully we do some guilt, as I see some Nathan Rice put out that he feels no guilt, shame, or stigma whatsoever. Yay. Okay, Renee.
Hello, everyone. I also want to thank Dr. Yip for having me to be a part of this and also shed light and hopefully inspire others or help others not to feel so alone in such a battle that can feel so isolating at times. Someone I look up to and definitely wouldn't have made it this far if it wasn't for her and for guidance and pouring her expertise into me. So I'm very appreciative. A little bit about myself. I've battled anxiety kind of off and on, like feels like majority of my life at this point. It's taken different turns throughout my life. You know, it tends to attach to whatever you care most in your life. So it shouldn't have been a surprise to me, but when I got pregnant very early in, I would say towards the end of my first trimester is when it took an aggressive turn for, you know, prenatal, what I call prenatal, because it hit when I was pregnant. So we began attacking it aggressively, and fortunately, I feel like I've been able to enjoy a lot of my postpartum as a result of attacking it pretty early. But that's not to say that there aren't my days that it really attacks itself as postpartum. So I'm glad to be navigating through that with obviously professional guidance and shedding light into my personal experience.
Renee, thank you for sharing that. I think I'm having a little trouble hearing your volume. Are you feeling that same way, Kevin?
Just towards the end, I heard you cut out a little bit, but I
Yeah.
heard most of what you said.
Is it better now?
Yes.
Okay.
Yes. Okay. All right. Well, thank you so much for sharing your journey with us. So let's talk about OCD, because I know that we can all go on forever about it, right?
Mm-hmm.
And I wanted to ask the two of you, when you first experienced OCD symptoms, and Renee, it might be at a different time period for you, like, where did you turn to? How did you know it was OCD? What was the challenge of getting the information that is so important? And I'm seeing in the comments that this is such an important subject because there's not a lot of information out there. There's also not a lot of research about this out there. So thank you for everyone who's chiming in. But Kevin, can you start and share what was that initial journey like for you to have OCD, and how did you even find out what it was?
Right. Well, to echo Renee a little bit, I know it varies for everybody, but in retrospect, I'm fairly certain I've had OCD and OCD-like tendencies and anxiety on and off since I was a teenager. And then after I had my baby 13 years ago, that's when it sort of became so pronounced. And I was mature enough myself and had enough of an understanding sort of the world, I guess, to realize that something was wrong. Um, that's all to say, I didn't really turn anywhere for the first several years because I didn't really know that what I was going through wasn't normal, although I did certainly always feel scared to some degree, I'd say, as a younger person. But then I realized within a couple of months after my daughter was born, this was early 2011, that something was going on, and I didn't really know the terminology for it, at the time, but I could tell that I was having really bad thoughts at the time about harm coming to my child and to my family, and really vivid pictures of all of this harm happening. And then I realized that what I was doing in response to those thoughts somehow wasn't making sense. Like, it occurred to me, like, I don't think this is helping when I found myself tapping, the stove and counting the taps, or when I found myself standing and touching my daughter's chest and checking her breathing, and I would have to count all of those actions. And it just kind of occurred to me nebulously that those actions didn't seem to be helping. And so I initially chalked this up to anxiety. I knew what anxiety was. And so I talked to my doctor and started a medication and SSRI, and eventually talked to a therapist. And then I don't remember if I found IOCDF first, but I was fortunate enough through Google and through whatever sort of search ability I had at the time to come across OCD and kind of learn what OCD is. And I remember saying to one of my providers that I think I might have OCD, which she thought was unusual, but we went through the initial screenings. Long story short, I ended up with a diagnosis in, I think it was late 2013. And that was after all of those years. The diagnosis was actually, it felt informative and empowering.
So it took how many years from the time that you first experienced OCD symptoms to the time that you were actually diagnosed?
If I had to if I had to guess and look back and identify obsessive thoughts and compulsions that follow those obsessive thoughts, I think that started for me when I was around 17. So it was about 15, 16 years.
Yes, yes. So, it's unfortunate, but even for OCD in general, it takes a good 14 to 17 years for someone to be diagnosed properly and to receive evidence-based treatment, which, folks, the evidence-based treatment for OCD is exposure and response prevention therapy, which is a type of cognitive behavior therapy. And we can go into that a little bit later. But, I mean, how was it having to go through that many years and not knowing whether you actually had OCD or is it just anxiety? Because the truth is, a lot of people, and even mental health providers who are uninformed about OCD, oftentimes will misdiagnose OCD as GAD, generalized anxiety disorder. That's a common misdiagnosis. So not getting the treatment that you needed, that could have deterred, could have like decreased experiencing this postpartum, right? Because during the postpartum period, even during the whole perinatal period, the main goal is to be able to bond with your newborn, with your infant, with your unborn child. And having OCD, those intrusive thoughts that keeps just hijacking your mind, makes it very, very difficult to bond, especially if it's about harm, right? If it's harm OCD, that makes it even harder. So how were you able to like manage during those 15, 16 years?
Yeah, I would say that the first few years of it, I kind of just was able to cope as a teenager. I was doing many compulsions, but I was able to get everything done that I needed to do in high school. And then later on in my later teens and early 20s, it got pretty dark for a few years. But I I you know, I chalk it up to part luck, part privilege, and part having access to some, fortunately, good information. Fortunately, I didn't come across misinformation about OCD. So fortunately, I came across credible information and was able to make my way to that. I look back and again, as a journalist, as a writer, I think about how many people are, in the same situation, and how really it is information is the first step, and understanding is part of that step. And so that's why I've always done everything I can, including reaching out to and interviewing Dr. Yip, who's always been so generous with her time and comments for my work. And I've written about OCD several times. But to your question, how I handled it, it was rough. And so I just think it's so important and heartening that IOCDF and Dr. Yip and Renee and everyone who's speaking out is doing so, because I really believe that that's how we change this experience for people and prevent them from going through years of maybe what they don't have to go through.
Yeah, yeah. I so agree with that. The misinformation is like probably the worst thing that you can do for a new mother experiencing OCD. And when there's already so much judgment on yourself being a new mom and worrying about, terrible things happening or what you're doing right or wrong, and then having that misinformation can do really terrible harm, especially if you're already suffering from OCD. So thank you for that. Renee, can you share your experience of what it was like going through, your experiences, your journey with OCD?
Yeah. So my journey also started when I was early teens. Mine is always kind of attached to like perfectionism and safety. Like I remember like obsessively worrying about safety of my family, like very young. Um, and it just kind of like, especially at a young age when you didn't know what it was or why am I constantly worrying? Like I felt like this can't be normal. I'm always worried about safety of my sisters. I'm always worried about safety of my parents. Then I had such a perfectionism personality to start. So then that kind of latched into other things. So, that's where mine always seemed to surround itself. That was like my theme for a while. And of course it did also take me a few years and I was very isolating at that time. I remember just like not understanding like why my brain was always ruminating of all these what ifs could happen to like my family. And so I it did take me as well a few years to get proper treatment, which is where me and Dr. Yip sort of initially crossed paths. And I was able to actually, fortunately, get it under control through my work that I did as an early teen. And then it started creeping back up in my adult life. But this time around, it was a different response because I knew what it was. So I'm like, oh, there it is again. And that's when I reconnected with Dr. Yip and we began working through things. But of course, then I was an adult. So it was a much more mature perspective I had with things. I also had life experience perspectives. I was able to just sort of understand. And I think that makes a huge difference. Like knowing what it is and knowing that, hey, a lot of these thoughts are actually like everybody has them, but it's just when you suffer, you have like if your brain's like just autopilots to obsessively, like worrying, it tends to just magnify those thoughts. Whereas someone else, they might not suffer with anxiety, but they still have those thoughts. And for me, it didn't come as a surprise when I found out I'm pregnant, super excited, and then boom, end of first trimester, I was like flooded with all these what I said in my when I was pregnant, they centered around I didn't want something to happen to my baby. So I would obsessively worry and check everything. It became a checking thing. And I never really had checking issues to begin with. So this was a new form, but I knew what it was. And I would check everything. I was obsessively check different things. I was very worried about something happening to my baby. And then I remember in one session with Dr. Yip, she actually had me list like, what are your ultimate worries? Like, what are your ultimate thing that your brain's latching to? I remember one of my things I put was, I need to be anxiety free to be a good mom. And I remember I spent that session going through how unrealistic that actually was, even for a mom that never, experienced anxiety. That's irrational. Like they're gonna also have that. So we just like working through that aspect of kind of rationalizing these irrational thoughts that anxiety likes to just magnify, and staying ahead of it helped me not to suffer really in my postpartum because we really tackled it hard during my pregnancy. And I'm so grateful for that because I was so worried my whole pregnancy. Is this going to affect me from being a good mom? Like that's just what I kept. And another thing that Dr. Yip and I spent a lot of work focusing with is OCD and anxiety. It really likes to operate under this all or nothing mindset of you have to be all perfect, or you have to enjoy this, or you're not good enough, or you have to do this good enough, or you're not good enough. And that's what it was really magnifying my whole pregnancy was. If you don't beat this, or if you don't do this, or if you don't, get this under control, you're not going to be a good mom. And Dr. Yip really helped me to bring me to a realization like two feelings can coexist together. So you can be worried or you can be stressed and still be grateful for your baby and still enjoy your baby. Like that's totally okay and that's totally normal. And as simple as it sounds, like that's what's really helped me. Like even as a mom, some of my tougher days, because we all have your tougher days as a mom, I really just reminding myself it's okay to be stressed today and still love my baby and still be overwhelmed. Like just because I'm overwhelmed doesn't mean I'm not a good mom or I love my baby any less. Like those two feelings can exist. And in a sense, it's telling my anxiety, like, be quiet, like you don't have a voice, and that's really what it is keeping that anxiety and OCD voice at a minimum, because once it starts talking loud is when those thoughts just start going vicious.
Yeah, it's funny that you're saying that because, in one of the chapters in my upcoming book, Hello Baby, Goodbye Intrusive Thoughts, it is just because you have an intrusive thought does not make you a bad mom. Because the truth is, we all have intrusive thoughts, right? And what differentiates one person with OCD and another person who doesn't is that the person with OCD will have the intrusive thought. And because there's already so much judgment and so much pressure of being a mom in general, with or without OCD, that when you have these intrusive thoughts, you're thinking, oh my gosh, why would I have such a thought? Right? You have thoughts of harm to your newborn or your unborn. You have thoughts of safety and risk factors, and you want to protect them. So you have these intrusive thoughts because you care. The person without OCD will have the intrusive thought still and go, okay, well, that's a silly thought, or okay, well, now I just need to be a little bit more cautious. What differentiates OCD is that those of us with it take it to an extreme, right? So we have the thoughts, we add this overvalued judgment on ourselves for having such horrible thoughts. Why would any mom who loves her child have such horrible thoughts, right? And that's what we tell ourselves. That's like the white noise that keeps OCD going. Except, again, OCD tackles whatever it is that we care about. If you care about, if you care about being ethical and having moral behaviors, then guess what? That's what OCD will tackle. If you care about, being healthy and not getting illnesses, then that's what OCD will tackle. And being a new mom or being a mom in general, what we care about, is our children. So then no one, this period, this sensitive period in our lives is what OCD will harp on, right? It's going to tackle this really fragile period because our babies are, no matter whether they're 1 or 21, they're important to us. So as long as we care, that's what gives OCD fuel. And I think a lot of people don't realize that, you have, as a mom, you have your intrusive thoughts of whatever, baby drowning, baby suffocating, baby being poisoned, you as a mom, feeling like you're not doing enough to protect your baby. And you feel like, I must be a terrible mom to even have these thoughts. No, guys, that's not how it works. You have these terrible thoughts because you care, not the other way around. So you said it really beautifully. I wanted to, there are some questions about, this is HG at 424. Amanda, if you can post this up. How common is it for postpartum OCD to be mistaken for postpartum depression psychosis? Okay. So I think this is probably one of the biggest common denominators of misinformation, okay, is that whenever a woman comes in with OCD symptoms, and unfortunately, some OBGYNs will check for postpartum depression, or they'll teach women about postpartum depression. However, there really isn't a lot of education or information or assessment during your perinatal, prenatal visits that looks into postpartum anxiety or postpartum OCD. And what do you think might happen if a woman goes into her OB who's uninformed about what OCD is, or goes to her pediatrician after the baby's born with these intrusive thoughts? What do you think happens often? So I have a thought of, I have intrusive thoughts all day long about my baby suffocating under the pillow. Okay. Yeah. What do you think happens at this point? I know you've written about it, Kevin.
Yeah, no, I've in my reporting heard providers who know better and who fortunately would know that this is looking like OCD might think this is psychosis, or that this person is in harm or in danger of harming their baby. And I've heard of CPS being called, which is utterly traumatic and terrible.
Yes. Yeah. So I would say that, it's actually very commonly mistaken, postpartum depression or postpartum psychosis, to be the common misdiagnosis for postpartum OCD.
Something I'd like to also add to that, because I remember in my postpartum visits having to, answer those questions and things. And I personally, and my husband attended my postpartum visits with me. So, and so he was there as well. And we both, I remember having a conversation, like, they're not even, I feel like, appropriate questions. Like, if you really want to zone into like what's happening, I don't even think they're appropriate questions, because there's a whole extra transition in motherhood that's not even really talked about. And that's going from like me and my husband, we have a restaurant business together. So I went from this very career driven working woman, and then I flipped to motherhood. And that's a big transition to go from being very social, very, in meetings and business meetings nonstop, helping him with anything and everything, to then full mom mode. And that it's a blessing, and I'm still, a stay-at-home mom and focusing with my baby, and I love it, and I'm blessed to have this opportunity. But it was a major mental switch. And I think there's a whole bunch of underlying reasons that can actually, and I, since I know how to stay ahead of it, I know how to use my resources, and I turned to fitness, and I have really good supportive mom group. I got out, I get busy, but I know moms that were also going through just having had babies and first time moms. And I was able to sort of help them more identify that, no, there's actually nothing wrong with you. You just went from a career woman to being home, and you just need to get out, or you just need to, tap into something that, you enjoy doing, whether it's fitness or, whatever it might be, cooking, or, whatever brings you joy. Like, look for your mom support groups. And I think that's something that a lot of women don't understand. Like, you can be a mom and still get out and do things, because I think that can also, just that isolation alone can sort of make symptoms that aren't necessarily like, and so that's why I say, like, their questionnaires they give you, I wish I could redo them, because I don't feel like they accurately assess what's really happening. And there are cases that there really is something bigger taking place, but I just don't think those questions that you're asked really filter through appropriately other options that can be. And that's where there's a lot of in my opinion, a lot of, like you said, misinformation. And there is a ton of misinformation out there, and it is overwhelming.
Yeah, absolutely. So, I think it's important to realize that because of all of this misinformation, it adds to confusion about what OCD actually is, right? And hopefully we're kind of dispelling some of the myths today about what postpartum OCD is. There's a comment here from Med Student 2003. It was at 420. So symptoms are not enough for a diagnosis. That is absolutely true. How you get diagnosed with OCD is it has to interfere with your functioning, right? So if you're someone who likes all of your books lined up, and if one is not lined up, you can keep, going about your day, go to work, go to school. That's not OCD. A person with OCD has intrusive thoughts, has whether they're physical compulsions or mental compulsions. We can't overlook mental compulsions, okay? That takes a lot of time in a day. It takes a lot of energy out of you, to the point where it interferes with your functioning. So, this really drives me crazy whenever people say I'm so OCD, because I like my closet color coordinated. No, that's not OCD at all. The way that I like to explain OCD, especially when it comes to intrusive thoughts, it's as if you have a nightmare. We've all had nightmares, right? So if you've had a nightmare and you can't wake up from that nightmare, and that nightmare keeps replaying in your head like a broken record, that is what it's like to have OCD. And if you had such a nightmare replaying in your head like a broken record, you wouldn't be able to function. You wouldn't be able to pay attention. You wouldn't be able to attend to your work. And sometimes, and this is the sad part, is a lot of moms, especially new moms during the fragile, fourth trimester of pregnancy or birth, then you experience these intrusive thoughts, and then you're afraid to be with your baby. Have either of you experienced that, where you're afraid of what you might do to your baby, or you're afraid of the harm that you might cause, or you're afraid that because you have all of the intrusive thoughts taking over your mental bandwidth, that you don't have the capacity to pay attention to every little detail that is required during this, postpartum period? Have either of you experienced that?
So mine was, and I've talked this, I think we talked about this in one of my early sessions postpartum, Dr. Yip. Mine was opposite. Mine was, I had to be with, I'm still working through it, but I've gotten better. I had to be with my baby. Like, I felt like I'm a perfectionist. I'm gonna I already worry about every what if. Nobody else is gonna worry about every what if better than me. So I wasn't taking a break. I was like straight mom mode. I remember around that, I think it was about 3 or 4 month mark. It was just before Christmas. I remember meeting with Dr. Yip and telling her I was burned out. And she was like, let's assess this. Let's talk about this. And I talked to her about it. And I'm like, I'm really not taking a break. I still am breastfeeding. So that did kind of like make my opportunities more slim to get breaks. But she helped me sort of work through things I could do and ways I could try to get a break. And I remember her analogy she used was like, how can you be your best for your baby if you're not recharging yourself? So I've had to really take a step back. I had a conversation with my husband, like, what are some ways I can start incorporating this at a level that I'm comfortable with? And it is a transition because I literally was with my baby, and I'm still with her a lot, but I would not take a break. I mean, I did not take a break, I don't think, until I was 4 months postpartum. And when I say not take a break, I mean, like, she was everywhere with me, doing everything. And it would cause me severe anxiety to leave her even for an hour. So mine was kind of reversed, but I don't want to give a wrong perspective that if you have opposite of mine, that, that's something different, because it can take different forms. So again, mine was more perfectionism, and I already worry about every what if, so nobody else is going to worry and prevent everything better than me. And that was what I struggled with, is trusting, even like my mom with her. And it's taken practice, but I've gotten a lot better. So, but we had to have a specific session that we worked through that in particular for me.
Yeah, so it can take, one form or another. It can be you're spending a single waking moment with your baby. I remember I had a really hard time leaving my boys. I have twin boys, and OCD happened pretty much immediately after giving birth to the boys. Before, for me, during the perinatal period or prenatal period, I was pretty chill about everything, but as soon as they were born, within the first 5 days, the ruminations started occurring, but one of my twins also had to be in the NICU. And I think that was a contributing factor to the possible harm or the possibility of losing my baby. And that's the truth, is that risk factors include, not having a strong support system, not having having OCD previously. So if you've had OCD, then you're more at risk of having postpartum or perinatal OCD. But the support system is super strong. And other risk factors, there's a question here from HG at 413 about whether having a C-section or vaginal delivery is a contributing factor, and we don't have any research supporting that. However, just know that anything that was tough to go through, right? So like if you've had a miscarriage, well, having lost a baby, you're going to be just more conditioned to fear losing another baby. And again, OCD is going to tackle whatever it is that you care about. So if that is your fear about losing another pregnancy, then yes, that's going to be a contributing factor. So and the other thing is I want to make sure people understood is that yes, hormones are part of it. However, there are also many fathers there who experience postpartum OCD. Now, so that goes to tell us that hormones don't explain it all, right? Hormones is just a part of the equation. Of when there's so much fluctuation in hormones, then it brings our bodies out of balance. And yes, that's a contributing factor. The fact that fathers also experience postpartum OCD tells us that it's more than just that.
Yeah.
One of the things that researchers find is that because this is just such a vulnerable period, in our lives when we have a baby, right? Our biggest role is to make sure that our baby survives, right? And if you remember, you have this helpless little body in your hand that if it would just flop away, if you're not holding it up, right, the baby will just flop over and break its neck. And I bet just saying that might give some of you intrusive thoughts right now, a baby breaking its neck. So because this is such a vulnerable period, and because hormones are fluctuating, and because like what was happening for you, Renee, you weren't getting any rest at all. These are all contributing factors. And then how much support system do you have? Do you have a partner who is very supportive of, this journey? Do you have family members who can come help, friends who can come help, right? So all of that is very important to minimizing the effects OCD might have. So let's talk a little bit about that support system. How did you guys find support during this time when you were experiencing perinatal, prenatal, postpartum OCD?
I have had a supportive partner and family members. Although I think I had an internal fear still of my thoughts and that notion of what kind of person or parent or mom am I if I'm having these thoughts of bad things happening to my baby, like my baby burning up in a fire. Like who has these vivid thoughts of their baby burning up? It's terrible. And so I didn't necessarily describe the thoughts I was having to my support system. I've become over the years a lot more okay with that. And even I like initially, I don't think I described those thoughts even to my therapist. It's almost as if I was fighting them, which is not helpful as we learn when we get treatment. So over time, I've reached out to, as Renee has, other parents in my community. The internet, I would say, is a blessing and a curse in many ways because you can ruminate and use the internet. I happened to use the internet to turn to communities of parents who also had their own forms of anxiety, and that's what I'm. The whole idea of what a good mom is supposed to think and supposed to feel. I'm so happy I had the opportunity to read Dr. Yip's book early, and I'm so happy I did. And I only wish that I had a book like that instead of some of the information that I did have when I first had my baby. And so what I've learned actually in my reporting and my research for my upcoming book, The Progressive Parent, is that, of course, as we've all three of us touched on today, is that every new parent has some level of anxiety and some level of thoughts that are maybe not as sticky as the ones that we have. But I think talking about the support system and who you turn to, it's good to have people around you, but I think especially other people with OCD or people who understand what intrusive thoughts are and are willing to describe them, so that other people don't have to feel so different. Because I've heard other parents or individuals with OCD say, nobody could have intrusive thoughts like the ones that I have. And so, yeah, I would say like for the first couple of years, I was a little bit alone in that until I started. I put myself out there, and the more I put myself out there, other people reciprocated, and I think that's a great thing. And that just came up because you asked about support systems. Really, those thoughts are like those kind of secret things that we keep that we need to stop keeping, I guess.
Yeah. So I think the support system, like you said, it's really important to have. And when you have the support system, when you have a strong support system, and it's important to put this in place, while you're pregnant, even before you get to the third trimester, to have that strong support system prepared. Because the truth is, once baby pops out, you have no time to even think about a support system, never mind trying to put one together last minute. And sleep deprivation is another contributing factor as well, right? So if you're sleep deprived, and this is true whether you have postpartum OCD or just OCD, when you're not getting enough sleep, it is a contributing factor for your OCD to be more intense, because you don't have the brain capacity to be present and mindful about navigating through that journey in the moment. So getting the sufficient sleep you need, especially as a new mom, is really important. And Renee, I was thinking of that conversation when you just brought it up, and I want everyone to realize that we use the word self-care a lot, and I hear this being thrown around in mom groups. Oh, self-care, self-care, self-care. And in my book, I talk about how self-care is actually a problem, because you're not really doing self-care, right? I think the word self-care comes with so much guilt. And unfortunately, guilt is part of that equation of OCD. We feel the guilt, and therefore we feel like something is wrong with us, and that adds to the vicious cycle of OCD. So self-care is not optional, though. Whether you are a new mom or a veteran mom, self-maintenance is
Yes,
not
exactly how you explain.
right.
Yes.
So if you're thinking self-care, well, self-care, I'm going to take an hour at the spa. No, self-maintenance can be taking just 5 minutes first thing in the morning to enjoy your cup of tea, right? It could be when you get home, if you have screaming children running at you, letting them know, hey, mommy just needs 5 minutes to myself, right? So self-maintenance is so important, because if you have OCD, you have to have the attention span to be present, to be mindful. Because the truth is that intrusive thoughts don't occur in this moment, right? When we worry, when we're ruminating, we're not ruminating in the present. We're either ruminating about something that has happened already, and we're sequencing our thoughts, checking to see if I've done something terrible, or checking to make sure that my to-do list is up to date, whatever it is, right? It's happening in the past.
Mhm.
Or if we are worrying about the future, about what we still have to do, making sure that all of your baby bottles are cleaned, whatnot, it's about the future.
Mhm.
Intrusive thoughts don't occur in this moment. Because the truth is, this moment, if we're able to be more mindful and present in this moment, there's no room for intrusive thoughts.
Mhm.
And to have that skill to be mindfully present is a lot of mental effort, right? And if you are sleep deprived, then you have no mental energy to be present. So having that support system, getting to sleep, doing self maintenance
Mhm.
to refill your fuel tank is super important to being well. And I don't think we do enough of that, especially as mothers,
Mhm.
and especially as a new mom. We don't give ourselves permission for doing that. And of all the mothers that I work with, many will say, well, but I can do that with this time instead. I can do more laundry, I can do more dishes, I can do more housework, right? If I have this time. And doing more housework will help me to feel less anxious and less distressed, right? Because I'm getting things done,
Mhm.
right? No, that's not true, because the laundry will always be there. The dishes will always be there.
Mhm.
Housework will always be there. Your mental wellness will not always be there if you're not taking time to maintain it. So that is super important, and I don't think we do enough of self-maintenance. So I'm so glad, Renee, that you took time to get away from the guilt, right?
Yeah.
Can you share some of that? Like, what was it like when I asked you to take time for self maintenance, and you actually follow through? Because even though I say it,
Yeah.
many moms still have that hesitation.
I remember for me, it was, I felt like I kind of had to push myself through that, because I remember when when in that particular section, I felt my anxiety sort of growing again. And it was around that 3, 4 month mark. And I remember telling Dr. Yip, I feel so exhausted and drained. Like, I don't even feel like I have mental energy to combat my anxiety. And I don't have a 3 month, she was 3, 4 months old at that time. I was like, I can't afford to like backtrack. I've made so much progress. And that's when we spent our whole session talking about that and things that, and of course, for everybody's situation, that, it's going to be different, but that have worked for me, that sort of like fill my cup before I start my day of motherhood, I guess you could say, is, I've always been into fitness and working out. So I needed like an hour and a half. And I work out, I drink my cup of coffee, maybe make a little bit of breakfast, get my shower. So that I feel like my personal cup is like filled. And then mentally, I feel like, okay, I can tackle whatever today brings me in motherhood. I've also had to lower my expectations of laundry is never going to be fully done. If I'm being honest, I always have a load of laundry going. And if it's not, I can guarantee you there are loads waiting to be washed. Whereas before a baby, I only had to do laundry a few times a week and I'd have it fully done. It's amazing how one little infant can add so much laundry. But so I've had to really lower my expectations as far as certain things that I hold myself to as far as part of being a perfectionist. So I had to lower that. When I also lowered that, and I also found I had a little bit more, I don't want to say free time, because it wasn't free time, but a little bit more like, okay, I don't have to always be doing this. And then I allowed myself also, it's okay to go get a massage. It's okay to go, it's basic human upkeep, I guess, just if you like getting your nails done or like going to get a massage. But I was having major mom guilt. That first like few months, I was canceling appointments. Like I would schedule an appointment and then I would cancel it. So I'd have such that anxiety about leaving my baby and mom guilt. So I was like canceling. So I was not taking that time. So I sort of used that session as like, okay, this is my permission. If I don't do this, like I'm not going to be restored enough to even be a kind of mom that I want to be. Because I remember telling Dr. so many times, like, I love being a mom. Like, I genuinely love it. I want to have more kids. But I don't want to be a tired mom. I don't want to be a worn out mom. I want to, when I'm with my baby, I want to be 100% present. I don't want to have all this other stuff like fogging my brain, whether it's anxiety, whether it's exhaustion. So honestly, I just had to step out of my of what felt like my comfort zone, because it wasn't a healthy comfort zone. So once I stepped out a little bit, then I was like, remember, I went like 3-4 months fully submerged in it, like no breaks at all. And I had friends that were taking breaks and doing date nights with their husbands and other things. And I was looking at them like, wow, that's awesome. I can't do that. Like, and not because I couldn't physically, I could. I just mentally, anxiety was like, I felt suffocated. Like, no, I have to do this. So it was breaking that barrier. And it's going to feel uncomfortable at first, and I'm still a work in progress with it, but I've come a long way since that initial 3-4 month mark that I was going through that.
It's good to see you refreshed.
Yeah, it feels a lot better.
Yeah, I call it the perfect household disease that we have, and unfortunately, many moms have that. We want everything to be perfect. We want the house to be perfectly clean, the laundry to be perfectly done. Everything has to be done. And again, if your mental health is on the line because of that perfectionism, then we got to break that perfect household disease.
Mm-hmm.
Right? Why is that more important than your bonding with your baby? Right? Your attachment, your this is a very critical period of attachment with our children. And when we are overvaluing baby bottles to be cleaned right away, laundry to be done perfectly, everything has to be done just so, then we're not prioritizing this critical period of bonding. So we all have to break our perfect household disease. And for all of you who are listening, I would challenge you to not do your laundry for an entire week. And that anxiety that you might feel, it is temporary, because once the week passes, you can go back to doing your laundry, but you might just feel more okay, in letting laundry go once in a blue moon if it's necessary for your own mental wellness. I rather you take time for self-maintenance than trying to keep up this facade of having a perfect household. So someone asked, how do you differentiate between OCD and some of these other conditions, just like postpartum depression or postpartum psychosis? And I want to clarify that when you have intrusive thoughts of harm, of safety, of illness, the feeling that you get from the intrusive thought is not one that you value, right? In psychobabble terms, we call that ego dystonic. The thoughts themselves don't sit well with you. They don't mean something that you really prioritize or that sits with your belief system. They're actually the opposite. You don't want to have the intrusive thoughts. But here's the thing. Whatever you don't want to happen, and you say, I don't want to think about it, don't think about it, don't think about it, you're just going to think about it even more. So if I ask you, don't think of the yellow duck, what are you going to do? You're going to think of the yellow duck. Why? Well, because you actually just put energy and effort into the image of a yellow duck, right? And this is why diets don't work, right? If I tell you, when you're on the diet, what is it that you have to do? You have to think about all of the foods that you're not supposed to be consuming. Well, that's a problem, because if I'm not supposed to be consuming chocolate covered strawberries, well, now I want to eat it even more, right? So that is a failed tactic. to just try to avoid thinking of your intrusive thoughts. In fact, the evidence-based treatment for OCD is exposure and response prevention therapy. And what that means is that rather than avoiding the triggers to your intrusive thoughts or to your obsessions, you're actually building up tolerance to them. And the only way to build up tolerance is by confronting what you fear, right? And here's the thing, your intrusive thoughts are just that. They're just thoughts, right? Is there really any harm in thinking of baby dying? It might break your heart, yes, because it broke my heart when I had to do my own exposures of my twin boys that I wrote about in my book, dying, because that was one of my fear, was that, you know, one of them went into the NICU and maybe would never come back out of it, or maybe, you know, there's the illness or health issues would return even after we left the NICU. So, you know, that's important to realize, is that when we avoid, it actually increases OCD even more. So can you share with us, Kevin, Renee, what was it like for you going through the treatment of OCD? Did you get to do your own exposures, and how was that?
Yeah, I can share. Initially, it was scary, you know, so before I knew about exposures and that trying not to think about something would make it worse, you know, I would give in and do compulsions after having obsessive thoughts, again, say about my house burning down or my baby burning up, or being kidnapped or whatnot. And so when I started to do the exposures, it was pretty unsettling at first, for sure, to think about my worst nightmares, and to kind of intentionally think about them and sit with them. But it got better. And to be frank, you know, my intrusive thoughts kind of come and go, and I usually keep them at bay. But every now and then during stressful times in life, I still get them, and they're still often attached to my kids. And it's interesting in a way to think about the forms that those intrusive thoughts have taken over the years, you know, when they started crossing the street and taking the bus to school, and having to you know, having urges to maybe follow them, or to constantly tell them to be careful over and over and over again, and constantly tell them the rules. Or my son, who is 11, he has this pet tortoise that is the most precious thing to him. And I almost have these like proxy obsessive thoughts about he loves this tortoise, you know, more than anything in the world. And what if something happens to this tortoise, which is very cute, and it has grown on me. But I'll have sometimes obsessive thoughts about bad things happening to the tortoise, and then it'll go as far as I have to break the news to my child that his beloved tortoise, you know, something has happened to it. And it's just the worst feeling. But I talk to my therapist about it, and we every now and then go through exposures of different forms. And it's never been as intense or long lasting or as disruptive as those thoughts were when my first child was an infant. But it's a work in progress, for sure. And I think for some people, medications and ERP is, I've heard folks say that they barely ever have intrusive thoughts even, or they don't really think about them. And so I'm one of those people where sometimes they're more sticky. Sometimes they're less sticky, but it's just fascinating to me how the forms of the thoughts change, and so how the exposures have to be updated a little bit. And it's so much easier now after years of doing it. It's like, oh, okay, I get it. Like now we're kind of putting together why we have to do the exposure this way. And so it's become less difficult, but it continues to be a challenge for sure.
How many of you, as I'm talking about it, I'm like getting a little choked up about thinking about my own children dying, right? I mean, there's a question here from Space Outlaw at 456 asking, what does it mean to confront those thoughts? And, the thing is, it means to keep thinking about the thoughts that you have, rather than avoiding the thoughts, which actually gives it more power and gives it more credence. You're allowing the thoughts to come through. You might even be writing a narrative about the thoughts that you're having, so that you're not giving it power anymore. And what I teach my patients to do is that you would write a script about it, right? A script is like a short story, just a couple of paragraphs about what the intrusive thoughts are. And then you would record on an audio, and then you would just loop the audio repeatedly. And even though initially, I mean, it's terrible to think about. No parent, let me just say this, no parent wants to think about their children dying, right? Or some harm befalling their children. And therefore, this is hard to be with. Except the more we avoid something, the more attention and space and credence we're giving to the thoughts. So then what's the opposite? Doing the opposite means we're actually going to make space for the thoughts. We're actually going to think of the thoughts again and again and again and again and again and again and again until the thoughts starts to fade away. Because the thoughts can't keep spiraling if you're not giving it power to spiral. And we take power away from the thoughts by engaging with the thoughts, by confronting the thoughts, listening to your script on an audio loop, right? That's called exposure. We're exposing ourselves to the uncomfortable thoughts. That's doing the hard work, So Renee?
Mm-hmm. I'm East Coast, so it's getting dark here, so I had to put an extra light. For me, it was, of course, uncomfortable, like, leaning into those thoughts. But one thing that I've learned in motherhood is where I would have given certain thoughts more attention before, I personally am so busy, like I have them or I'll feel, a rush of anxiety but I'm so busy, especially because I'm alone a lot taking care of my baby, that I can't pause to give them attention. And what I've learned is like an hour or two go by and it'll just kind of fade it away. It won't be like super present and feel suffocating. So it's actually, in a sense, trained my mind to now when I have them, I'm more confident, like, oh, it's going to go away. Almost like, as confident, if you haven't, say you do a new workout exercise, just my analogy, you do a new workout exercise, you do a new exercise and your muscles are sore. Well, we know, we don't worry, oh my gosh, am I going to feel this pain forever? Like we know by a certain point, half a day or day goes by, you're going to feel fine again. I feel like that's what's kind of happened with my brain from just going through it so much that I've built that confidence in myself. I'm not going to say I don't ever have a thought that tugs a little harder, because that would be, it's not. But I would say 9 times out of 10 now, I just have that confidence, like it's going to go away. And sometimes I'll even say to myself, okay, when she goes down for a nap, then I'll give it attention. And by 4 hours later, when she finally goes down for a nap, I've like forgotten about it. And so I've built up that confidence now where I'm able to not feel that tug as much. And one thing that also has helped me is, and I do this with my husband, is sometimes I I almost like in a sense consider just like releasing that thought. Like I feel like when I internalize it, I'm giving it more power because it just wants me to keep it to myself. It wants to just eat me alive and just keep it to myself. And that's one thing I've gotten better at doing is just being like open with him. So sometimes I'll tell him like, I don't expect you to solve this problem because there's no solving it, but can I just openly tell you this thought that's really driving me crazy, and something about just saying it with him and just getting it out, I feel less alone. And sometimes we even respond with, I was having thoughts like that also, or, I actually share this with Dr. Yip, that my husband was actually transparent with me. And after our daughter was born, he's like, I've never in my life worried about what ifs. He's always been like a very carefree guy. He's like, and now I do. Now he doesn't, ruminate over them and give layers of anxiety to them, but those thoughts were entering his mind, and he shared some with me. And he was like, because of what I've seen my wife go through, he knew what it was. And he was just like, and he did comment, it's crazy how as soon as you have something you genuinely care so much about, your brain, it does. And it goes back to what Dr. Yip said about men have it too. And that's how we know it's not just hormonal related, because 100% I saw it with my own husband. So we've kind of a mutual thing now, where if I'm having a concern or I'm having a thought, I just put it out there and I say it to him, and I leave it. I try to tell myself, okay, that's as far as it can go, and move on. So that's what's helped me personally. It might be different for someone else, but that's been my niche that's worked. I would say 9 times out of 10, it's worked for me.
Yeah. So what you basically do when you're having these conversations about the uncomfortable stuff is that you're expanding your comfort zone, right? You're expanding your comfort zone while minimizing the effects the thoughts have. Right? We only avoid things if we truly fear them. Right? So if you had a saber tooth sitting in front of you, are you going to avoid it? Hell yeah. However, the intrusive thoughts don't really carry any weight if we don't give it that value.
Yeah, and that's what I felt by telling it to my husband. And then telling myself, after you tell him, walk away. That's as far as you can give it. I was like taking away its value, because it wants me to sit there, obsessively worry. It wants me to keep it to myself. So telling myself, no, share it with someone you truly are comfortable. It doesn't have to be your husband. If it's somebody else, a close friend, or, a sister, whoever, for me, it's my husband. That for me was like taking its value away. Like, you're not going to just let me go through this and feel isolated. And that's what I feel like it really tries to do for me. Anxiety likes to make me feel isolated, and it's only me, and only I'm going through this, and only, I'm having these thoughts. So by, openly sharing with my husband, for me, it felt like I take away its power and its value.
Yeah, and you're actually taking the shame away from the thoughts when you're able to share the thoughts with other people. And remember, shame and guilt is a contributor to maintaining the vicious OCD cycle.
Yes, 100%, I agree.
So if we want to break that OCD cycle, we have to be able to remove the shame, remove the guilt. And what better way than to share the thoughts, right? Because if I share the thoughts, then I don't feel shame for sharing it. I have these intrusive thoughts. They're ego dystonic. They don't serve any meaning other than trying to hijack my mind.
Yeah.
And when I share it, I'm opening it up. I'm opening up the conversations. I'm talking about it. So it's not as important. It doesn't have that hold on me. I don't feel imprisoned by the thoughts.
It's kind of like, you say that, it's kind of like if you got, diagnosed with a serious illness, would you go through that journey and keep it to yourself? Like, how awful, much more awful would you feel? Or if you confided in someone you trusted and just had a supportive person, that you're, and maybe even reach out to other people that have gone through it, and maybe they tell you some tips. Hey, this worked for me, or this treatment worked for me. Like, why is anxiety and mental illnesses any different? Like, why do we feel like we have to internalize it? Because in reality, if you go and you got diagnosed with an autoimmune issue or anything else, cancer, whatever it might be, you're not just going to hold it. Who holds it to themselves? So it's like, why do we feel with, anxiety or any other mental illness? Why do we feel like we have to keep it to ourselves? You would
Yeah.
never expect somebody that was just diagnosed with cancer to keep it to themselves and go through treatment alone.
Yeah.
So I think breaking that barrier, like it's okay to have that supportive person that is your crutch to carry you through or just be your safe zone is totally needed, 100%.
Yeah, absolutely. So talking about it, you're breaking that attachment that you have with the thought, right? So, like you said, if I have, cancer or heart disease, I'm going to be sharing it with people. I'm going to get my support system
Look
because
at the resources and leaning into those you trust.
yes, because I'm not attached to
Mm-hmm.
the disease, right? And OCD is no different. If you are not attached to the disease, then it doesn't mean anything other than you have OCD. And there's no need for the shame and the guilt that actually magnifies and intensifies the condition.
Mm-hmm.
So one of the things that, exposure is just one part of the treatment, right? The treatment is called exposure and response prevention. And the exposures take care of the O in OCD. It takes care of the intrusive obsessions.
Mm-hmm.
And then the response prevention is what targets the compulsions. That's the C part in OCD. So can you and what that basically means is that you're not going to carry through. You're not going to carry through with the compulsive behaviors,
Mm-hmm.
whether compulsive behaviors are occurring physically or mentally.
Mm-hmm.
So can you guys share some of the response preventions that you had to do to ignore that urge to engage in a compulsion?
Yeah, for me early on, one that I remember really well is I used to stand by the front door and touch the lock to make sure it was locked, and then I would tap it 5 times, and then it wouldn't feel right, and so I would tap it again, and I don't know how long I spent doing that. And that's just one example of my many. So the obsessive thought would be the thought of an intruder breaking in, hurting my child, abducting my child. And so then the compulsion was the lock tapping. And so one of my first response prevention exercises was at bedtime, I could check once that the front door was locked, or that any of the doors in the home were locked. And then instead of touching it or counting it, I was allowed to visually check once, not touch it again, to make sure that it was in the locked position. And then I was supposed to walk away from it and go to bed, which at the time sounded preposterous. And I'm laughing, even though it's very horrifying, because looking back, I'm laughing half in relief that I don't have to go through that anymore. But, the first few times, very hard. And then it got easier and it got easier. And I must say, I still, as I mentioned, have issues with intrusive thoughts, but I shudder to think if I hadn't learned ERP, especially the response prevention, what kind of, I think ERP has helped my parenting so much, because I can only imagine the kind of, I might have an intrusive thought about my child gets run over in a parking lot because she and her teenage friends like to go get a smoothie at the smoothie shop. And so I'll have an intrusive thought of her getting run over at the parking lot. But if I had never done ERP, I would surely, or at least very often, have the urge to follow her or make sure that she's not getting run over, or text her over and over again to make sure she's being careful, or not letting her walk to the smoothie shop with her friends. And so that's just to say that like that early response prevention of having my child safe in a crib, in a room, she couldn't go anywhere. I'm so glad that I had really went through the response prevention then, and that it, has worked well enough that I, every now and then I might do a compulsion, and my therapist says, that's okay. Like, instead of doing it multiple times a day, every day throughout the day, maybe now like once a week, I might go unplug something that like I feel like I need to unplug, and I'll feel a little guilty about it. But I know that that was like a one-off, and for the most part, as Renee said, like it's not gone away, but it's just so much better.
Yeah, the truth is that your intrusive thoughts aren't going to go away.
Yeah, that's something we talked about before I had my daughter. Is I remember I said I want to live an anxiety-free life and fully. And I remember Dr. Yip like literally like, let's break this down to reality, and that actually giving myself that it's okay for it to come and go, but let's always stay mindfully ahead of it. It was kind of like giving myself a like a break from that. You have to be, you have to be. And now looking back, I laugh at myself because I'm like, why did I ever think that? In a sense, I feel it's actually made me a better mom because I'm more mindfully aware of certain triggers. So I'm able to stay ahead of them. And kind of like you said, especially we're revolving around safety. And my baby, she just turned 10 months old, so she's still very young. So I haven't gone through as many different stages, but it doesn't mean I still haven't had those what ifs. And I'm like you, I give myself that you can check once or you can do this one, because I was a big checker because safety, checking, everything. And then for me, if it's a little bit more, as you refer to, intense of a feeling that you feel like you have to satisfy, one thing that I do is if my husband's around, I'll be like, okay, you check once also. And it kind of feels like for me, it's like relieving that 100% of her safety is up to just me. Because in reality, like it's not like, he is dad also. So sometimes if we're getting ready to go somewhere and let's say I like check our stove top because maybe I was cooking breakfast and I'm like, okay, was everything turned off? And I feel that I got to keep checking and make sure everything's off. I'll just say to him, can you just do it once over? Everything's off, correct? And he's like, yes, let's go. Then I tell myself, okay, that's it. It stops here. But I don't keep running back in and checking and making sure. Or I would actually, at one point, I would like take a photo so that while I was out, if my brain was like, are you sure it was off? I could look at my photo. Yes, everything was off. So I just was like always, full safety. Like I never wanted anything. So it's just kind of like giving that it's one and done. Like there's no going back. Because in reality, like I don't want to give a false like assumption that you can't. You have to be this non-worrier. It's okay and it's healthy to like want to check and make sure your door is locked before you leave your house. Or go to bed at night. It's just when you repetitively do it, that's when it becomes overwhelming. But a once and done, that's okay. It's when you start second guessing yourself and your mind starts playing those tricks, because OCD and anxiety wants 100% always. It wants all or nothing. It wants you to always know 100%. So, it's breaking that mental barrier and then keeping it broken, because as soon as you start doing it too many times, it just grabs you again. So for me, I just do a one and done. You can check once. You can check your baby once. You can check, make sure she's breathing once, but repetitive is where it starts interfering. So I'm like you. That's what I found works for me, and I feel like keeping it at a healthy level where I'm still ensuring safety. I'm not completely neglecting and saying, oh, well, I'm just never going to check locks. I'm never going to check her. Everything's fine now. But keeping it at a healthy level, and that's where working with Dr. Yip, but continuing to work with her helps keep me in that healthy aspect as well.
Well, OCD is a doubting disease, right? So, and if there's anything that is uncertain that you want the answers to, then you're giving OCD room to come and take over and hijack your mind again, right? And the truth is, the only certainties in life is death and taxes. And I've had patients who tell me, well, you know, soon death won't be a certainty either. You know? Yes, Texas will still be a certainty, but death maybe not one day. But until then, you know, the truth is our world is filled with all sorts of uncertainty, and we can't control the environment. We can barely control our own behavior sometimes, right? So it's important to accept and tolerate the uncertainties, and that's pretty much the biggest part of treatment is. The biggest part of treatment, exposure and response prevention therapy is to be able to tolerate the uncertainties that come with life. Because you might feel like, I have to know, I have to know, I have to do this to prevent X, Y, and Z, except in the moment you're living right now. You're talking about, well, you know, letting my daughter go get her smoothie. And Renee, I know you're already ruminating about the possibility.
I know.
Your
I'm
daughter.
sorry.
Yeah,
I didn't want to make you think about how your daughter might get a smoothie someday.
right. But right, we have to be able to tolerate uncertainties, because the truth is, whenever we step out of the house, how do we know that we're going to come back? We don't.
We don't.
We step out anyways, right? And we step out anyways because we're actually tolerating uncertainty. So the uncertainties are always there. We might not be hyper vigilant around the uncertainties that do exist, yet every single day we tolerate uncertainty. And that is the biggest part of treatment. You know, some people wonder, what about stress? You know, like, what about anxiety? If you're pregnant, you know, the goal is to decrease stress as much as possible so that you're not adding stress hormones to, you know, the fetus. But the truth is, when we do ERP, exposure and response prevention therapy, we're not doing anything new that your brain isn't already doing, right? I'm not creating new intrusive thoughts for you. Those intrusive thoughts are already occurring without your permission, right? The OCD monster has hijacked your brain and is poking you with all of these horrific, terrible, intrusive thoughts that you don't want to have, which is what causes the spiral of anxiety. So when we do ERP, we're not adding anything new. All we're doing is containing the thoughts, right? We're just specifying when are these thoughts going to occur rather than, you know, having it occur randomly. The metaphor that I always use, it's kind of like, if you're not doing ERP, then you've basically got an IV drip of intrusive thoughts going into your veins every waking hour. And I would much rather take control over that by containing the thoughts in a specified time of my choosing than letting my OCD monster take control over that and just, you know, keep hitting me with these intrusive thoughts. And every time I get one, you know, yeah, I get that lightning bolt of discomfort going up my spine. But that's why exposure and response prevention therapy is so important, because when you do have that jolt of anxiety going up your spine, yes, initially it's very uncomfortable, like what you were saying, Renee. However, over time, you start to build tolerance to it, right? Because if that yellow duck will get boring if you thinking about it. It's not that interesting. Intrusive thoughts will also become less antagonizing. You know, however, if you avoid it, then it will continue to have its power. You're face to face with it, acknowledging its existence without giving it any more value, then it doesn't have power over you. So you know, we need to build that flexibility in our thinking by being present, by being aware, by allowing intrusive thoughts to just be rather than trying to control them, avoid them, and getting rid of them. Is OCD different during the perinatal period? Remember, OCD tackles whatever it is that you care about at any point.
Mhm.
And during the perinatal period, it's usually focused on either the baby's wellness or our own wellness, right?
Mhm.
So I know a lot of women during the prenatal period, they
Mhm.
worry about, am I going to be okay? They start having intrusive thoughts about their safety,
Mhm.
going through labor, the complications that might occur.
And I had that. That's how mine started. And I remember having very specific sessions with Dr. Yip of kind of tackling those from a rational level of like, okay, what are things that are okay to worry about in research? And a lot of them, I remember in one of our sessions, I was struggling with like, I didn't want to use any like topical products that could be, harmful or anything like, and maybe I shouldn't be eating. And then I didn't feel like my OB was giving me good and thorough insight. And I don't mean that as from like an anxiety standpoint. I just genuinely didn't even feel like she was just giving me very vague answers. So I remember we actually had a whole session kind of like talking through that. And just as an educational standpoint, I was beyond grateful for that because it kind of showed me that like part of it wasn't anxiety. It was just me genuinely wanting answers as a first time pregnant mom of like actual solid answers. So I was actually very, very still grateful for because she did give me like a lot of different guidance towards what's safe and not safe, when you're pregnant, and very specifically too with certain products and stuff. But then it also, as I got more into my second trimester, it would go into even internally, like if I was about to eat something and if it looked a little off, or before I didn't even give it a second thought, but I'd be like, oh, what if this makes me sick and harms my growing baby? And so that's where mine was very specific when I was pregnant. And for me, I had, and I'm just going to share this in case anybody else watching, could relate, but I had an anterior placenta. So my placenta was up front and it blocked a lot of me feeling a lot of my baby's movement, which is normal. But you can only imagine how much more anxiety that gave me. Like I had friends that were also pregnant when I was, and they would post these little videos that they could literally see their baby like moving their belly. I never saw that. I would only really feel her good when her legs would kind of push out sideways more to my ribs. But it was very common for me to go several hours without feeling a lot of good movement, more even into my third trimester. And so you can only imagine from somebody that already has, battled with anxiety, how much that drove me nuts. And I ended up asking my OB, hey, can we maybe do like weekly visits? They were going to start them around like 34 weeks, but I was like, can we start doing them like 30 weeks? And it honestly, I just have a lot of anxiety with this anterior placenta. Like, I just want at least a weekly confirmation things are still okay. And they really worked with me. So sometimes I also will encourage women, like, just because maybe your OB is recommending, hey, not this till 34 weeks. If you feel like, hey, if you just at least get that once a week extra checkup, if that's going to just relieve a little bit of anxiety, like that's what I did. And I feel like it kept a lot of extra anxiety, unnecessary anxiety, just having that weekly confirmation, hey, things are okay. And, that was my personal thing where it really, so once my baby was here, I think that's why I also felt a major, relief from my anxiety. Cause I was feeling like, okay, she's finally physically here. I can physically see she's okay. But, then it of course turned to, okay, now I don't want anything to happen to her, so it does change forms.
Yeah, I want to differentiate that though. You had a really valid reason for getting that extra checkup. And
Yes.
I want to differentiate that with people who are listening from, that as a compulsion.
Yes.
So if you feel your baby kicking, you see your baby kicking, your baby's there, and you still want to get that extra reassurance.
Mhm.
Okay, now we're going toward the more excessive part
Yeah.
of OCD, right? However, you have a valid reason for
Yeah,
getting.
I remember my husband actually questioned me at one point. He was like, "Are you sure this isn't just anxiety or OCD? Like you're just wanting constant reassurance?" And I was like, "No, because I know my days that I feel more movement, like I specifically over at my ribs, like she's got to be moving her leg outward." But and then a good friend of ours who's actually already had 3 kids, she had an anterior placenta with one of her children. And she actually was able to tell us, no, there is 100% difference. It drove me crazy for that one pregnancy. My other two pregnancies, I was so chill and calm, but that one, she actually said, she's like, I specifically requested extra visits too, because she said I had a regular placenta and then an anterior one. And so she's like, I'm like, okay, my last pregnancy, I felt all this movement and now I'm not, like, what's happening? So that kind of helped my husband to then be like, okay, this isn't anxiety. This is actually a real issue, and let me support her and let's go for extra visits. So, yes, that was good,
Yeah, and I think it's important for those of us who do have a partner that we educate them about OCD. So, because sometimes what ends up happening is everything becomes OCD, right? Oh, that's OCD. Oh, that's OCD. No, not necessarily.
Exactly.
OCD is when we take it excessively, when we take it to another extreme. So having a partner who is open and willing to understand and learn is super important, part of the support system that we started this conversation on.
I agree.
Yeah. So unfortunately, we're a minute past the time, and I want to be mindful and respectful of everyone's time. So perhaps you guys can share a closing remark about how are you doing now that you have your OCD under control, Kevin?
Yeah, I've shared a lot about how my thoughts have been lately, but I'm doing well, and I'm just so thankful for the work of the good therapists I've had and the good providers I've had, Dr. Yip and so many other folks with IOCDF and Renee. Really briefly, I think of OCD as like a metaphor for parenthood, because in general, people just want 100% certainty, but what people really need to understand is there's always a tiny risk, and all we can do is keep that risk as reasonably tiny as possible. And that's what I talk about in the book and connect with my OCD. So thanks again, and I hope everyone continues to learn more.
Thank you for sharing your experience with everyone, Kevin. Renee?
No, I agree. I'm fortunate to sort of be at that better end of things now, and I am so fortunate that I was able to start working with Dr. Yip earlier so that I can be ahead of it and really, feel like I get to enjoy my motherhood now, but also staying mindfully ahead of it. And I think that's what's important is lean into your support, whoever that might be, lean into that, have them hold you accountable, and just make sure you're leaning into those resources, and don't be ashamed of it, because I know I've been so ashamed at times, and to even share or even open up with other moms like, hey, I'm battling this too. And motherhood's really pushed me out of my comfort zone in that, and being more open about, hey, I've gone through this too, and this is what I've learned. And so I also want to encourage anyone going through it to just not be ashamed of it, feel comfortable talking about it with someone you're comfortable with and you genuinely trust, and that there is hope and things, they do get better. Just give it time, and allow yourself a little bit of leeway, like a little bit of, it's okay to have tougher moments. It doesn't have to be an all or nothing. It's okay to have tougher moments. And there's a good analogy I want to share real quick that I've started adapting in motherhood. And it's like every day doesn't have to be 100%. If you only have energy for 30%, then giving 30 or 40% that day, that's your 100% for that day. And that's okay. You're going to have days where you're well rested and you're all mentally there and baby slept all night. And those are your days to give close to that 100%, but every day doesn't have to be 100%. And just adopting that simple mindset can really just relieve you from a lot of, just extra anxiety and stress.
I'm going to add to that. I love it, Renee. I'm going to add to it. I would say to break your perfect household disease, purposefully not make it 100%. I don't care if you're striving for 99, 89, however. I think that's important to remember. So I want to thank everyone here. There's a link to my book, my upcoming book, where I share a lot more about my journey through the postpartum period with my twin boys, but lots more tips, strategies, for new moms and beyond. So thank you. And I hope this was helpful and it gave some of you some reassurance that the intrusive thoughts that you have doesn't make you a bad mom. In fact, the opposite.
Mhm.